Hi everyone, welcome to our second annual Free the Pill Fest. My name is Soumya Jaiswal. I am a current third year student at the University of Cincinnati. This year we are talking about liberating marginalized communities, what reproductive sexual education has to do with all of these, and how we can advocate for ourselves as young people. With me today is the incredible Hannah Kim, a fourth year student at the University of Cincinnati who will be matriculating into the medical school in fall of 2023.
Hi, Soumya. Thank you so much for having me here, and I'm so excited to have this conversation with you.
So, Hannah, we're both actually pre medicine students over here at the university, and that's given us some really different insight onto, how birth control and how abortion and how reproductive health as a whole needs to be treated. Because also, as women, we've had experiences in that as patients, and also we're starting to receive education of how to be practitioners in this environment. But of course, there's so much that is not as great as it could be. There's so much that we need to change, both like educationally and just societally, with how we deal with issues such as birth control and abortion, how we destigmatize them, and everything like that. So, what are some times that you felt that as a student you aren't doing patients justice in the education that you're receiving?
Ooh, starting off with a deep question. Yeah, there's definitely countless times where I do feel like the issue is even anytime we do bring up like reproductive health or any type of like women's care, there's so many populations left out, and the central focus will always be Caucasian women. So anytime we do actually discuss the rare times we do discuss about women's health, it's always in the perspective of a Caucasian woman, like, oh, like what are like the mental side effects of like getting an abortion, or like there's never a talk about like how accessible it is and your marginalized populations, especially perhaps like people of color, especially at younger age extremities. I feel like they're never a part of the conversation, especially like the particular stigma that is carried around birth control in particularly Eastern communities, whether that's like Asian communities or like Middle Eastern communities. I just feel that there's never that conversation that there are greater barriers when talking about especially things like sex. So even like at the hospitals when I'm shadowing physicians, and the physician comes in and straight up asks, and maybe a Hispanic mother, if she knows her daughter is having sex. Like I see very adverse reactions from the mother, and there's just this lack of delicacy and touch to being in tune with how differently like anything regarding sex and birth control, and how differently that's viewed in populations outside of the Caucasian population.
That's such an excellent point, especially when you consider most of the educators as well fall into that like very narrow description. Most of our educators are like Caucasian males, and the student population doesn't look like that anymore. The incoming med student population doesn't look like that anymore, and the patient population has never looked entirely like that. So, what do you feel like are some challenges that I think like curriculum wise we might see? Like, do you think we're going to see this divide between like the more set in their ways educators that have always viewed things through this very narrow lens versus students that they're getting ready to be healthcare practitioners too, and they want comprehensive and inclusive and equitable education? Do you think there's some kind of rift that we might be seeing in the future or already see?
Oh, certainly. It's evident now, even at the undergraduate level. The vernacular is just different. They don't use abortion inclusive language. They don't even use like racially fair language. Like I still have been called like Oriental in like professional settings, and um, what's trickier as a student is what's trickier as a student is that there's a power dynamic. So even if you see these things going on from these much older, seasoned professionals who have been at their jobs for like 10, 20 years, where they haven't seen change. And I think the academic world is so much slow with change. You're very, very less likely to like bring up the need for change or bring up any sort of criticism. And so we do see a lot of younger professionals, someone like Dr. Sarah Pickle, who are coming in and bringing up what needs to be changed about our education. But until we do have more people with like more liberating mindset, like the students are going to be taught the exact same thing. And I even see some incompetent medical students who, like, in the patient care setting, they'll just say the most outrageous things, or just come in so unaware of a lot of like social disparities and in healthcare that you should know about. So that's definitely a concern that I'm worried about running into with not just my professors, but also my peers.
Yeah, you bring up such a good point. We have conversations in like classes and seminars all the time about how to deal with the lack of, I guess, propriety that we sometimes see in the more older and established healthcare workers and doctors, but at the same time, because of the power dynamics, you can't do anything about it. Like we're at the bottom of the totem pole right here, and so I think there needs to be a conversation, absolutely, with everyone on the entire totem pole. Like, listen, if you get called out for something, you gotta listen to it. You gotta take it to heart. You can't shrug off a med student or an intern, because what they're saying, if they're calling you out on something, is probably correct.
Yeah, it can feel a little disheartening at times, especially I feel like Cincinnati kind of has that. Uh, Sometimes like you only see like the majority of the population, which is the Caucasian dominant population. So I have felt like, specifically in Cincinnati, a little more discrimination, and so there's definitely going to be that struggle going into medical school. But also, I think this even applies to like a much younger age, like a lot of young girls who aren't receiving the same proper education about sex, or about healthcare, or about even transgender healthcare. Like, they're not getting that same level of education, so they're much more prone to literally life-threatening situations. So even more than like our education, I do think like the younger population needs to be considered when we're talking about educational reform, because they're definitely at risk, and they're at such a vulnerable time in their life, that they need to have that kind of access to information.
Absolutely. You bring up kind of sex ed reform, and that's been such a hot topic lately, especially with the whole anti critical race theory thing that's just popped up out of nowhere, it seems. So, do you think that there's anything that perhaps students, young people can do to advocate for themselves when it comes to something like birth control or access to medications in the face of perhaps elders in the community or even healthcare professionals that aren't, treating them with the same level of respect that they might other patients, or with the level of respect and quality of care that they deserve?
Yeah, absolutely. I definitely think it's on us. Like, personally, I do feel very responsible, because I know that I didn't receive the proper education that I wanted. And especially going in as a future healthcare professional, I do want to be conscientious and do my part in pushing for the younger generation to have access to information that I didn't have, and that put me in really like dangerous situations, and situations I shouldn't have been involved in the first place. So I definitely think that, especially like us college students, have so much power, especially in our advocacy groups. We're in such close contact with Cincinnati public schools. Like, we do things with Hughes all the time. I think we carry a lot of just manpower, not so like much so like influence, but I think we have the capacity to do a lot of good work. Like, we can actually be going into these schools. We could be leading like small classes, pushing for changes to syllabi, and the your healthcare classes. So I do think especially like people our age, definitely have a lot of capacity to cause change.
Hannah, it's been so wonderful speaking to you. You have such an incredible insight on what it means to, be a future healthcare professional of America and what that means now and how we can enact incredible change into this world.
Awesome. Thank you so much for having me.
All right. Thanks, everyone.